So hi everyone, my name is Kelly McCluskey and this is a video for the SPECS 683 class at Ball State University on social stories. So I wanted to put a little few disclaimers in before I start my social story. So this is my social story. As you can see, it's printed in grayscale because I don't have color ink on my printer, but the social story I will be using will have color. And since this social story, I'm going to do it for the video the traditional way that it would be presented. But specifically for this one, I'm going to send an email to my client with the social story link as an attachment so she can download it and we can be 6 feet apart so she can have it on her computer and I'll have it on my computer and we'll go through it slide by slide. So as you can see, the client is not with me tonight because I don't have a photo release to do it with her. And she is also an adult. So I know traditionally the wording in social stories is usually more simple, but since she is an adult, I want it to fit it to be age appropriate. So it is a little bit longer of a social story for that reason. All right, so my social story is called Staying Healthy During the Coronavirus Pandemic. So staying healthy. Being healthy is always important. People have to make sure that they are taking care of their bodies because when they are healthy, they feel happy. Typically, being healthy means things like eating vegetables and fruits, exercising, finding time to relax, and being able to socialize with friends or family. So what is coronavirus? Coronavirus. People may also hear the coronavirus be called COVID-19. Coronavirus is like a germ that can make people very sick, like when people get the flu. So coronavirus is considered a pandemic. Pandemic means that it is happening to everyone around the world. So we're all in this together. How does someone know if they have coronavirus? So someone who has coronavirus can have a fever of 100.3 degrees, feel extremely tired, be coughing a lot, have a stuffy nose, feel like their body is aching, have a sore throat, have a difficult time breathing or shortness of breath. So not like after you work out, but like if you're just relaxing, it's really hard to breathe. Not being able to taste food or smell things. So if someone thinks that they have coronavirus, they should call their doctor and talk to them about how they're feeling. The doctor will give the person advice and may ask them to get a special test to see if someone has coronavirus. So how can I stay healthy during coronavirus? People should cover their mouths when coughing or sneezing, wash their hands, stay inside, practice social distancing, use a face mask or face covering, and wear gloves. So how should I cover my mouth when coughing and sneezing? So 1, you bend your elbow and put it up to your face. 2, you cover your mouth and nose. So here's an example, and here's a non-example. So you want to use your elbow to cover your mouth rather than your hand or anything else. Washing your hands. So everyone should be washing their hands frequently to make sure they are staying healthy. Everyone should wash their hands when coming inside after being outside, immediately after touching another person, and after touching an object that another person has touched. So how to wash your hands appropriately. So step 1, wet your hands with clean running water, warm or cold. 2, apply soap. 3, rub your hands together with the soap. 4, rub the soap on the backs of your hands, between your fingers, and under your nails. 5, scrub your hands for at least 20 seconds. And then this would be the point in the story where I would have the client demonstrate that action. So staying inside. Everyone is staying inside their house. You can do many things while you are staying inside, including painting, doing a puzzle, watching YouTube, chores around the house, reading, and playing with dolls. How do I practice social distancing? So social distancing is a new concept for everyone. To practice social distancing, people all over the world are staying in their homes, staying away from others to make sure they do not get sick, and only going to the store when they need necessities such as food, toilet paper, or water. If you go outside for a walk, you can wave at your neighbors from far away. When people come over for therapy, they will sit 6 feet away from you. So here's an example of people waving, and this is how far people are going to be sitting when they come for therapy. So wearing face masks or face coverings. You might see people wearing medical face masks, bandanas, or other things that will help cover their face when you go out in public for necessities, or when people come over to your house to provide therapy. Do not be alarmed. They are trying to stay healthy. So here's a couple of examples of what you might see. Wearing gloves. You might also see people wearing gloves when they come to your house for therapy. You go to the store to get food, or see people when you go out for a walk. Some people may even ask you to wear gloves when they come over to your house and start doing activities. So when will everything be back to normal? No one knows what date things will be back to normal right now, but it will end. So when the doctors tell us that it is safe, people will be able to go to work, school, and hang out with their friends like they did before. Everyone is going to do their part to end the virus. If you do your part by following the rules we just reviewed, you should stay safe from getting sick and help stop the virus. And here's just a reference sheet for washing hands and the symptoms of coronavirus. So that was my social story, and thank you for watching.